pregnancy is going to decrease the SVR. Pregnancy is like a natural volume overload state, but it's got a little bit of a twist because the plasma volume rises like 40% and your cardiac output is going to surge. And yet, the systemic vascular resistance goes down. Yeah, it's interesting. The vascular resistance goes down because of a cocktail of vasodilators like nitric oxide and prostaglandin in the mom. And this adaptation ensures that smooth perfusion of the placenta in the uterus occurs. And even though the blood volume is up, the central venous pressure is going to stay normal. Why? Because the venous capacitance increases. And so this combo is going to lead to edema, especially in the legs. And as that oncotic pressure was going to fall and fluid seeps into the tissues, you got to remember that there is a decrease in the systemic vascular resistance. Okay, so here's our 35-year-old woman, 33 weeks of gestation. Mild leg swellings, got some edema, bilateral, no proteinuria compared to non-preg. What is most likely decreased? It's going to be your systemic vascular resistance. Why? Because of the vasodilation from the prostaglandins, nitric oxide, and placental hormones. This is essential to maintain the uteroplacental perfusion. So even though we have a lot more blood volume, we gotta dilate so that we can keep the perfusion going. Okay, so what is most likely decreased is the question. Blood volume, no, it's increased. Cardiac output, definitely increased. Central venous pressure is gonna stay normal, actually, due to the increased vascular capacitance and despite the high volume. And your pulmonary vascular resistance also decreases, just not as dramatically as your SVR. So there we have it, folks. Your SVR is going to go down when you are pregnant, and at the time we're recording this is like Mother's Day. So happy Mother's Day to all of you guys for going through that. Thanks for putting up with an increase of 40% of your blood volume and increasing your cardiac output and decreasing your SVR. I could never do it. All right, like and subscribe if this is helpful. We'll see you in the next video.